Hello, I'm Dr. Kedar. I'm a consultant pediatrician with Lotus Hospitals in Kukatpally, Hyderabad. Now we will discuss in short about typhoid. What is typhoid? Typhoid is caused by a bacteria which is called a Salmonella typhi. This is usually transmitted by food, water, air, hands, etc. So mode of transmission is usually by food or by hand or uncleanliness or fecal-oral route in medical science we call it as. The bacteria Salmonella typhi usually gains entry into the intestines. The major household housing of the bacteria is intestines in the human body. So abdominal symptoms are very much commonly seen. The usual symptoms are high grade fever followed by abdominal pain, abdominal tenderness, and sometimes loose motions also. Loose motions can be bloody, mucoid, contains mucus or sticky elements in the stool. So the abdominal symptoms are predominant in typhoid. So once the diagnosis is done, diagnosis can be made usually after the 5th day. Before the 5th day, immunological tests are done, something like Typhoid, which measures the IgG and IgM of the bacteria in the blood. After the 5th day, a specialized test called as Vidal is usually done. Positive Vidal is regarded as typhoid being positive. So the child usually comes to us in a dehydrated state where the child requires admission to the hospital, requires IV fluids and a specialized antibiotics. Now the most important caution about antibiotics which I want to say here is antibiotics should be given for 10 to 14 days in typhoid. Many of the times we come across parents who usually stop the antibiotics once the symptoms are better, like the 5th day or 7th day when the symptoms are better. But the typhoid bacteria has got a propensity to stay inside the body for a quite long time and multiply in the body and just remain dormant. And once the child is again weak immunologically, let us say with any viral fever or some other infection which causes slight lowering of the immunity, then the symptoms start back again. This is called as relapse of typhoid. So to prevent relapse of typhoid and to eradicate every bacteria present in the system, the doctor's advice needs to be followed strictly. The only advice what I can give you now is please do follow the antibiotic protocol as advised by the doctor. And in typhoid, usually 14 days of typhoid antibiotics are recommended to eradicate every bacteria in the system. Thank you.
Lotus Hospitals is one of the leading brands for all your health needs. You can visit our expert doctors at any of the centers, Lakdi, Kukatpally, Nagar and Vizag. For booking an appointment, you can use our app or visit www.lotushospitals.in or call on 040 4040 4444.